Hello students. As we all know, food poisoning is a very common illness. It can affect anyone. So in today's video, we will discuss causes, treatment and prevention of food poisoning. Now, food poisoning is an illness caused by ingestion or consumption of food or water contaminated with bacteria and or their toxins or with parasites, viruses or chemicals. Now, signs and symptoms of food poisoning may include abdominal pain, vomiting, diarrhea, then headache, fever, reactive arthritis, and bloating. Now, abdominal pain, vomiting, and diarrhea are the main symptoms of food poisoning. Now, abdominal pain occurs due to abdominal muscle cramps. Vomiting is a major symptom of infection with bacteria like Staphylococcus aureus and a virus like norovirus. Now, diarrhea is usually watery, but it can also be bloody or it can be mucoid diarrhea if bacteria invades or passes into intestinal epithelial cells. And this diarrhea usually lasts for less than 2 weeks. And therefore, we can say that food poisoning causes acute diarrhea. Now, apart from this, it's very important to note that serious cases of food poisoning can lead to neurological, hepatic, and renal syndromes leading to permanent disability or death. Now, let's discuss different causes of food poisoning. That is the bacterial, viral, and protozoal infections causing food poisoning one by one. Now, let's first talk about bacterial infection. Now, this table tabulates most common bacteria causing food poisoning, their signs and symptoms, and sources of bacteria. Now, the first bacteria is the Staphylococcus aureus. Signs and symptoms are nausea, vomiting, and watery diarrhea. And Staphylococcus aureus is found in improperly stored food. Next, very common bacteria that causes infection or produces food poisoning is the Bacillus cereus. And signs and symptoms of this infection are nausea, vomiting, and watery diarrhea. And this bacteria is commonly found in contaminated fried rice. Another common bacteria is the Clostridium perfringens. It also produces abdominal cramps and watery diarrhea. And this bacteria is found in inadequately cooked meat, poultry, or legumes. Another very common bacteria that causes food poisoning is the Vibrio cholera. It produces watery diarrhea and it is found in the contaminated water and food. Another very common bacteria is the enterotoxigenic E. coli. It produces watery diarrhea and this bacteria is found in contaminated water and food like salad, cheese, and meat. Another bacteria is the Salmonella species. Now, this Salmonella species, it invades the intestinal mucosa. It invades the intestinal epithelial cells and it produces bloody, inflammatory diarrhea. It causes inflammation in the intestine. And sources of Salmonella are contaminated beef, poultry, eggs, and dairy products. Another very important bacteria is the Shigella, and this bacteria also invades the intestinal epithelial cells. They cause inflammation of the colon, inflammation of the intestine, and signs and symptoms of this infection are the dysentery, that is the stools with the blood, cramps, tenesmus, that is the urgency to pass the stools, fever, and the sources of Shigella are contaminated vegetables, milk, ice creams, and water. Now, talking about the viral infections, rotavirus is a very common viral infection. It produces fever, vomiting, watery diarrhea, and it is found in the infected stools. Another virus is the norovirus. It produces vomiting, watery diarrhea, and norovirus is found in the contaminated food and water. Protozoal infections are not very common, but one common protozoa that causes food poisoning is the Giardia lamblia. It causes mild bloody diarrhea, nausea, and abdominal cramps, and this protozoa is found in the contaminated water. Now, talking about the precautions which can avoid food poisoning are cook food and meat at a temperature above 70 degrees centigrade. At this temperature, most of the bacteria, virus and protozoal infections are killed. Wash fruits and vegetables thoroughly before eating. Now, wash hands thoroughly before meals. Milk or dairy products should be sterilized. Milk should be pasteurized. Now, very important, implementation of wash sanitization and hygiene, that is a wash program. Now, majority of diarrheal diseases can be prevented by the implementation of this wash program. And this program aims at interrupting fecal oral route of transmission. Now, frequently hand washing with soap or hand sanitizers, especially after using toilets before preparing or eating meals, can reduce the incidences of food poisoning. Now, apart from this, consume clean water, wash hands thoroughly after using toilet. Then remedies for food poisoning. Food poisoning is usually self-limited and therefore most cases do not require treatment, and thus management is generally supportive. So first and the foremost, provide rest to the body. Now, as we all know, dehydration is a major risk factor associated with diarrhea, which is caused by the food poisoning. So, replenish fluid and electrolyte loss by the administration of oral rehydration solution. Apart from this, a bland brat diet is recommended, and this diet consists of B stands for bananas, R stands for rice, that is the white rice, A stands for the applesauce, and T stands for the toast, that is the white toast. So this diet is highly beneficial. It is a low fiber food diet, and we can add probiotics to the meals. Probiotics consist of beneficial bacteria. One of the richest source of probiotics is the yogurt or the curd. Anti-secretory or anti-motility agents like loperamide are also found to be beneficial. They reduce the duration of diarrhea. However, it should be avoided in high fever. Loperamide should also not be given in severe abdominal cramps or dysentery, that is blood in stools, and also in children. Then antimicrobial therapy is also prescribed in few cases. Antimicrobial therapy also reduces duration and severity of diarrhea caused by food poisoning. Metronidazole or tinidazole is prescribed for Giardia infection, that is a protozoal infection. Now, very important to note that this video is meant to provide general information on food poisoning, and therefore medications should be consumed in consultation with a physician. So, if you find the video useful, kindly like, subscribe and share this video. Thanks for watching this video.